When we think about childhood leukemia, we often hear these amazing success stories. And it's true. For most kids, modern treatment works incredibly well. We're talking survival rates over 80%. But what about that other 15 to 20%? For them, the fight isn't over. A relapse can happen, and it often shows up in ways you would never, ever expect. So today, let's break down what that really looks like. Just try to picture this for a second. A child gets diagnosed, they go through years of really tough treatment, and then they're declared cancer-free. Life goes back to normal, 1 year goes by, then 2, then 5, 8 full years. You'd think that story's over, right? That the book is closed. Well, it turns out sometimes there's an unexpected final chapter. Okay, so let's dive right into our first section here. And the best way to understand this is to look at a real clinical case, one that shows just how complex and, honestly, how surprising this journey can be. So let's follow the journey of this one young boy. He's just 2 years old when he gets diagnosed with a high-risk type of leukemia. It's a tough road, but after 2 years of intense treatment, he gets the all-clear in 2014. And for the next 8 years, life is good. He's growing up, he's in school, he's just being a kid. But then, at age 12, something completely unexpected happens. And what's wild is that the change wasn't dramatic at all. He felt fine. No pain, no fatigue, absolutely no sign that anything was wrong. This was found during a completely boring, routine annual checkup. His doctor just noticed something wasn't right during the physical exam.
So the diagnosis comes back, and it's something called an isolated extramedullary relapse. Now, that big word extramedullary, it just means outside the bone marrow. And this is the incredible part. His bone marrow was totally clean. The leukemia had basically found a hiding spot, a little sanctuary in his testicle where chemo couldn't quite reach. And from there, a few surviving cancer cells managed to reemerge all those years later.
And that really is the question, isn't it? For the family, for the doctors, for everyone. After so many years of clean checkups, a relapse like this is just a profound shock. It forces everyone to completely redefine what it means to be cured and to gear up for a whole new battle. All right, let's move on, because this one boy's story is just one of the many, many different ways a relapse can appear. It really does have a lot of different faces. Now, this is probably the most common type of relapse, a return right to the source. The leukemia pops back up in the bone marrow, which is where it all started. The symptoms here are kind of what you might expect with leukemia. Blood counts are always low, there's unexplained knee pain, and lots of easy bruising. Here's another example of that extramedullary relapse we were just talking about. For this 11-year-old girl, the very first sign was the sudden appearance of these hard, painful lumps in her neck. The cancer had managed to sneak into her lymphatic system, which is a huge part of the body's immune network. And then there's this scenario, which is particularly challenging. The leukemia actually crosses the blood-brain barrier, this protective shield, and gets into the central nervous system. The symptoms might just seem like a bad bug, headaches and vomiting, but a test of the cerebral spinal fluid reveals the truth. The cancer is back, and it's in the body's command center. So if we zoom out and look at the big picture, you can see that a bone marrow relapse is the most common, happening in about 2/3 of cases. But a really significant chunk, we're talking nearly 40%, are extramedullary. That means in almost 4 out of every 10 relapses, the cancer comes back in one of these sanctuary sites, like the central nervous system or the testes. Okay, so with all these different forms of relapse popping up in different places at different times, how in the world do doctors make sense of it all and figure out a plan? Well, they have a system. They classify the challenge. Clinicians basically look at 3 really critical factors to get a handle on the relapse. First up is location. Where did it come back? Is it the bone marrow or somewhere else? Second is timing. Did it happen early, while the patient was still getting treatment, or late, like years after? And third is something called the immunophenotype. You can think of this as the cancer cell's unique fingerprint. They check if it's the same type of leukemia or if it has changed over time. So, and this is the crucial part. This classification system directly tells them what to do next. A late relapse, like the boy from our first story, might be considered standard risk. But an early relapse, one that happens while the patient is still on therapy, well, that's considered high risk. This whole system is key to deciding just how aggressive the new treatment needs to be. Which brings us to our final section. Now that we've seen how complicated relapse can be, let's look at the absolutely groundbreaking treatments that are offering new hope for these kids and their families. The biggest game changer in this fight is, without a doubt, immunotherapy. Instead of just relying on chemo to poison cancer cells, doctors are now figuring out how to harness the power of the patient's own immune system, basically teaching it to become a cancer-killing machine.
And at the very front of this revolution is something called CAR T-cell therapy. It's not just a drug, it's a living drug. It's a personalized treatment that's one of the biggest leaps forward we've seen in cancer treatment in decades.
So here's how this incredible process works. Doctors take a patient's own immune cells, these are called T cells, right out of their blood. Then, in a lab, they genetically reprogram them. They give them this special receptor that acts like a GPS to find leukemia cells. Then, these supercharged cells are infused back into the patient, where they multiply and go on the hunt. It's like turning the patient's immune system into an army of leukemia-seeking missiles.
And the results? Honestly, they are nothing short of astonishing. In the early trials for kids with relapsed acute lymphoblastic leukemia, we're talking about patients who often had no other options left. CAR T therapy has led to remission in over 80% of them. This is a total game changer, offering real, lasting hope where not long ago there was very little.
So look, while a leukemia relapse is an absolutely daunting challenge, it is no longer the end of the road. With a much deeper understanding of the disease and with revolutionary treatments like immunotherapy, we're really entering a new era of possibility. There's a saying in the field that really sums it up. In relapse, new therapies are not just treating the disease, they are rewriting the future for patients. The fight is definitely more complex than we once thought, but our ability to win it is growing stronger every single day.